not be able to take a shower. So we have some special dressings that can go on there. You can kind of look at that. And then the other thing is the bio patches. These are what I was talking about, antimicrobial discs, okay? And then when y'all come around, just look at them. But it just looks like foam, and it's got a little cut and a little hole in the middle of it, kind of like a donut with a little cut out of it. Obviously the line should be in the middle of there. And then this has a foam side, and then one side actually has, I'm just gonna show you. There's the back. One side, some of these have like a blue paper
They're coming
on
around.
They're walking.
They're
it.
coming
Just in
around.
case there's more people coming. And if it has like the lettering or the words on it, that'll be to the outside. Does that make sense? Like this one in particular doesn't, but there's some that have like a blue kind of backing, like paper backing on there. And so it would go just like this, right? Okay, pretty straightforward. Now, I threw one kit down, where did I put it? Yeah, that one right there. So that kit is just a little bit different than this kit. But again, if you read the contents, you know, when you grab one of these kits, just always read the contents. They list it on the outside. Just read and say, you know, I need an extra mask, or I'm gonna get another pair of gloves because it has a medium pair and I wear large, or whatever, right? I didn't know if you guys had seen these, but central lines, like I said, just a little bit longer. So a lot of times what you'll see on the outside is like that, right? And it might be sutured in place if it's set up like that. But you can see it's just a little bit longer than that PIV that we're using. Some of these can actually be even longer, like these tunneled ones that are very long, all right? Now, again, you can have them in a bunch of different places, but I'm gonna change this one out just so that you kind of see, okay? So I have my kit, and on here it says it's got one pair of gloves, one gauze, one medical tape, one mask, one skin protectant, one applicator, one alcohol pad, one antiseptic, and 2 gauze sponges. Now, I've kind of explained this procedure to you, basically. When you read through that, is there anything else that you would want to get before you go in the room?
It's in there.
Another mask? It's got a
There's
mask.
a mask in there.
Probably an additional pair of
It says one mask. I would want a second mask. Why?
the patient.
For the patient, right? So look at that, you guys already know going into the room what you should have, right? I'm gonna go ahead and I'm gonna just move this just for a second. Okay. All right. Come on. Or down. All right, whatever. All right, so patient sitting in here. They're laying in bed, right? And I'm like, you know what, I gotta do that line dressing change. This is one of those things where, you know, you do it once a week, so you know that it needs to be done. Or you come in on your assessment in the morning and you look and you say, oh man, that thing is soiled, I need to change that, right? If you come in and you see this thing soiled on your first assessment, when are you gonna change it?
Then
You could do it right then, but at the end of the day, like, you kind of look at it and you say, I'm gonna be right back in here. Because you do an assessment before you give your meds, yeah? Everybody does that? That's what you see in the hospital all day long? You guys are a bunch of liars. All right, but the way that it should work is you go in, you get report at the bedside, you kind of see the patient a little bit. After you're done giving report, you come back, you do your assessment, and that guides you to figure out whether or not I should give these meds. That's not what happens. That's what should happen, okay? That saves you from giving a med that you shouldn't be giving, okay? So when you come in, you do your assessment, you know, and you do your head to toe, working your way through, and you're like, you know what, that's sold. I'm gonna make a note. I'm gonna come back and change that, right? And I always kept a piece of paper called a Cardex, and it would have like my hours that I was gonna do things, and I'd put on there 8 o'clock meds. I'm gonna go ahead and change my central line dressing and get it done first thing in the morning, right? Patient's like, you know what, I like to eat breakfast and then take a shower. When am I gonna change this thing? Look at the critical thinking, right? You're not gonna change it and say, go ahead, go jump in the shower, right? Because then you're gonna have to do it again, okay? Now, I do got the barriers, they work okay, you know what I mean? But again, why work harder when you don't have to? Think about these things. All right, so I walked in, I said, hey, Mr. Jones, my name's Justin, I'm gonna be a nurse today, I'm gonna do your dressing change, I'm gonna get my little table, my steel table right here, sorry. Right, but that's okay. We'll make it work. All right. So, hey, Mr. Jones, can I get your name and date of birth? Oh, John Jones, 1674. Perfect. Hey, I'm here to change out your central line dressing because I saw it's a little bit soiled. You don't have any pain or anything, are you? No? Okay, good, good. So when I do this, I'm gonna actually take this dressing off and put a new one on here along with a bio patch. But I'm gonna be wearing a mask. You're gonna be wearing a mask. I'm gonna have you turn your head this way, away from the dressing while we work. Is that okay? Good. Have you ever had this done before? Yes, perfect. Do you have any allergies to anything? No. All right, good. Do you have any questions before we get started? No. Perfect. Okay, excellent. So here is your mask, Mr. Jones. Put the mask on now before you even get started, right? So you come in, you've done your hand hygiene, you put on your gloves, right? And then you're gonna kind of assess and, you know.
Would you fill it with gloves or without?
I would, I mean, if you're not gonna come into contact with blood or bodily fluids, you don't need gloves. But some people wanna put gloves on before they touch anything in the room, and that's absolutely fine too. So me personally, I would come in here and touch them without gloves. Let me take that back. If this was a woman, I'd put on gloves because it tends to make it less of a skin-to-skin contact, right? So people are a little bit more comfortable with that. So a guy, I'm gonna come in here and do this. A girl, I'm gonna put on gloves on. I know that's weird, but that's just my standard thing, okay? All right, so I check. There's no redness, there's no drainage, no pain when I kind of touch. I don't feel anything. Like I talked about with, this is a tunneled catheter, okay? But I talked about like a subclavian. Where's that one little catheter at? I just want to show you. Okay, so if I came in and this thing, and a lot of you guys were wondering, you were like, man, why is this side squishy like this? It's because we could actually put these in if we wanted to, but you know, I don't. So it's good. But anyway, a subclavian might look something like, well, maybe something more like this, okay? So if I saw a line here, I'm gonna make sure and kind of touch in case any of that subcutaneous emphysema like we talked about. At the same time, not only am I assessing right here, I'd be assessing right here, kind of looking at the whole picture, right? Don't get so focused on this little spot that you miss that the person's breathing 24 times a minute. You know what I mean? An IJ would look more like this, okay? All right, so I'd come in and all of that would be inside, you know what I mean? So I'd kind of look at that, make sure the dressing's on there, okay? And then again, in case you don't know what the groin line would look like, it'd look like something like that, okay? All right. All right, so I'm gonna make this dressing change. So mask on, turn your head. I'm just gonna go ahead and touch and just make sure, no pain, no pain. Beautiful, sounds great. So I'm gonna go ahead and change this thing. So I'm gonna open my kit up and I'm going to make sure that my table is up a little higher. All right, I got my mask. Blue side out, yeah. Oh, yeah. Squish down my nose, take out my gloves. I'm gonna just set my gloves right up here. Sometimes I'm watching in some of these skills checkoffs, and so people are doing this kind of number. They're taking their gloves, and then they take it and they open it up over top of their sterile stuff. Please do not do that. You have tons of space, especially this one, right? Over here like this, all by itself, so it's nice and good. Okay, do I need to reach over this and touch anything?
No.
No. I still have my clean gloves on, right? Because I said I put my clean gloves on to touch, okay? So I'm gonna go ahead and remove this thing. Now, for the checkoff itself, you will probably have a little bit of trouble taking this off of here with gloves on. So, talk to the faculty and just kind of say, hey, I would have my clean gloves on to remove this. However, I have a lot of trouble getting it off of this thing. Does that make sense? Okay. So, the direction of insertion, this catheter was put in this way, right? So I said you're gonna remove it in the direction of insertion, okay? But I still gotta loosen the whole thing up. Now, when you're doing this, listen to that. Good stick, good adhesion, I guess I should say. How do you think that feels for the patient?
Feels terrible.
Yeah, they're gonna love that, especially right when you get over their nipple too, you know, they're gonna really love it. So if you can avoid it, don't put these over the nipple. If it can't be avoided, like this one where the line placement, I mean, it is what it is, you know? You try to avoid it if you can, but.
Can you use like rubbing alcohol?
Or like
So
the
they do have adhesive
remover.
removers, and then they also have, some kind of, they got some other stuff to kind of help it kind of stick and adhere a little bit, and kind of barriers. So when you're going over the nipple, those might be nice. Every facility has slightly different stuff.
So
Okay.
if someone who has an airy chest, do you shave before you apply that?
It's a good call. What do you think?
Yes.
Yeah. So you usually will have to shave people to get them nice and clean so they get up against there, okay? But when we get this all the way down, now I'm gonna show you something. The person that did this one last time used this little 2x2 and put it like that. The reason I don't like that is because it's very hard to separate the gauze from the transparent dressing, okay? So it's actually very hard. So please don't do that, because you just make it really hard on the next person to come in for checkups. All right, there is one of those little dressings in here, but don't use it, okay? All right, and this is kind of the old school. We moved away from this into the bio patch, okay? All right, so when I want to remove this thing, I'm going to stabilize. Again, I have my clean gloves on, okay? I'm going to stabilize. I'm going to pull in the direction of insertion, okay? Now you watch what this, I want to show you what the gauze does. See how much pressure it's putting on there? Please don't put the gauze on there. Bio patch or nothing, okay? All right.
Like in checkoff or in real life?
Both.
Okay.
Yeah. Just use the bio patch, and if you don't have a bio patch, then don't put anything underneath there. Because if there is drainage and you put that gauze, it collects and then it just grows bacteria, right? So, you know, you're hiding the drainage, but, you know, you're probably going to cause a problem. Sound good? Okay, so I pull it off in the direction. I take it, roll it up into my clean gloves. I throw that away. I do my hand hygiene. We good? Mr. John's still looking at me over here, okay? So I'm going to talk to him. All right, Mr. John, I'm going to go ahead and put on my gloves and change out your dressing, okay? I've seen you guys do some amazing things with these gloves. But remember, I mean, I'm impressed sometimes because I'm like, man, I thought you were going to break for sure. All right? It's palms up, anatomically correct. So sometimes you guys are still trying to go like this, you know? Palms up is the easiest way. All right, so once you have your gloves on, can your hands go below your waist?
No.
No, they're stuck, elbows in. You are stuck, okay? All right, so boom. So look at this, I have a protective wipe, which is beautiful for nipples, okay? But you can put it over everything, all right? And so you could break this and kind of rub it where you need it to, okay? We're not gonna worry about that for checkoffs, but for a real patient, that is a nice thing, so it doesn't tear the skin up. All right, for a real patient, you would break the chlorhexidine, and you have a alcohol swab if you wanted to. We're not gonna use them right now, but you got the Q-tip, okay? And so what I like the Q-tip for is we can take the Q-tip, we can hold stuff up. Oh, look at that, my hand's still sterile. We good? All right, break. All right, and I'm gonna go ahead and scrub. Nice and loud. Everybody in the room should hear my concentric circles coming around, and I'm using friction. Making sure not to go back over what I just cleaned. We good? All right, now I'm done with that. I come up. You know what else you got? You also got alcohol wipes. So there's no reason to take this that was all the way out here and touch the site. Don't touch the site. But if you did have some crusties, those alcohol swabs are great at getting the crusties off, okay? So, maybe a little bit, you know? All right, so we're done. Cool. What am I gonna do with this?
Throw it.
Throw it. Should I put it right in here?
No.
Should I come over all my stuff? No, just toss it, okay? All right, now, if you were doing this on a patient, right, again, I've told you guys on 2 of these skills, I tend to work with a trash can right between my legs, so I can just say, okay, done. Cool? All right.
Question.
Yes, ma'am.
So I wiped it now, clean,
Uh-huh.
right? Then you brought that back to clean the ceiling.
Uh-huh.
That's what we should do.
That's okay.
Okay.
Yeah. I didn't go right onto the site, but I started on the line and came up the line. Okay. It's still saturated in chlorhexidine. Does that make sense? But I don't want to, even though it's clean and bacteriostatic, I don't necessarily want to stick it right on the site again, okay? But again, holding it up and just kind of work it out. Now, if you don't like that, you have another option, all right? So you can use this and you can clean these scrubbies off. Cool? Okay, so that's all done. We're done there. The gauze, the fenestrated gauze, okay? I don't need y'all to do anything with it. Right? At this time, I'm just letting it dry for 30 seconds. I'm not doing this. I'm not blowing on it. Okay? I take my Tegaderm, And for practice purposes, you're gonna say, I'm gonna take my tegaderm and I'm gonna place it right in the center and boom, done, right? That's for practice. For checkoff purposes, you're gonna say, okay, I'm going to go ahead and separate this. Like this here, I would apply my bio patch with the slit up, right? Those round discs that I talked about. And I'm gonna come back over here and avoid the nipple if I can, but put it right in the center, kind of work it down. All right, is there still a sterile piece to this? Am I done with the sterile part?
You're done.
Done with the
You're
sterile
done.
part. So only sterile part is when the old one comes off, the cleaning, put the new one on. Once you're done with that, you can touch stuff, okay? So, like I said, while I'm not trying to say that the Foley's harder, there's just more steps that you gotta maintain sterility than this one, okay? Some of these, when they get old, the paper doesn't come off all the way. If that happens to you during the checkoff, just say, sorry, I would do my best to get it off. And they'll say, that's fine. Come on, come on. All right, so you peel the paper off. What else do I need to do?
Label it.
Need to label it, right? So,
But you don't label it.
label it right here, put it on. Sound good? We can label it before, you know, but honestly, I tend to do it afterwards because it's like, I need to get the sterile piece done, you know, but you could do it before.
But would it be sterile if you're touching on a Sharpie that you use?
Yeah, not necessarily, and again, the thing is that you'd be working on the outside of it, so that piece, the outside of this isn't really sterile, right? It's the inside, which you got the backing that you're gonna take off. So, once you're done cleaning, can you grab your pen and write on there? Yeah, in theory, because you're not gonna touch the inside of that and you're not gonna touch that. Does that make sense?
Mhm.
Just something in my mind says, I just wanna finish what I'm doing, and then once I'm done, I go ahead and I put the label on, cool? When we put the label on, we don't wanna put it right over the site, right? We wanna put it off to the side so we can see the site the whole time. We good? If we did need to, if this was like this, like for real, super long like this, I'd take some of this tape and I'd just secure it down again, you know, so it's not pulling on them all the time, we're gonna get snagged on anything.
And it's date,
Initial
time,
date.
and initials.
Yeah, exactly. And then when I go to document, when I'm documenting the computer, I'm gonna document that I did my dressing change, I'm gonna document anything that I saw, right? Like it's cleansed, it's clean, dry, and intact, there was no drainage output, all that good stuff. Yes, sir?
So for the cleaning of the site, that initial concentric circle will be right up against it, right?
Yeah, right on the, yeah, actually take it and stick it right on the site. It's like, all right, so I got my Q-tip. All right, so I got my Q-tip, got it up, and I'm gonna start cleaning, all right? So boom, I'm gonna start right on it, and then I'm gonna come around it.
Okay, right on it.
Go all the way around this way, yeah.
Okay.
Good? Seem a little easier? Yeah, it's not bad. You guys will be fine. Any other questions?